That's the good news.
I feel like I'll probably just roll with it if I do something silly, but that's just me personally. So,
but now you've been doing this work for how long?
A year.
Is it going good?
Yes, it is. Yeah, I'm really.
Well, everybody knows who you are.
Well, hopefully.
You've made your rounds, right?
Yeah.
Hi, what a pleasure it is to introduce Amanda Ross, Clinical Outreach Manager for Charlie Health, correct?
Mm-hmm. You got it.
And, Charlie Health is fairly new. It's been around for about 4 years, but I'm thinking that our audience might not be familiar. So tell us about them.
Yeah, I'd love to. First, thanks for having me today. I'm excited to be here and share the wealth of Charlie Health. So Charlie Health, as you mentioned, has been around for about 4 years now. So technically we were created before COVID time.
Okay.
And Charlie Health is actually an all virtual platform. So what we are aiming to do here is ultimately end suicide, right? Our mission is to really be a tool and prevent suicide from occurring in the world that we're living in.
Right, which of course we want to happen.
Yeah.
And it's interesting because you said it started before COVID, and now, so much of what we do is virtual. I teach students virtually. We have virtual meetings, right?
Yeah.
So it's like it really, I'm sure the need for this has even grown, not only because of, mental health issues and all of that, but people's ability to be able to just connect on when it's convenient for them, right?
Absolutely. Yeah.
So Charlie Health offers a wide range of services targeted for a variety of audiences. What do you see individuals coming for?
Yeah, great question. So the thing about Charlie Health is we're able to really serve a large population. So specifically our program is known as an Intensive Outpatient Program.
Okay.
So what that means is we're able to support as a step up from a traditional outpatient therapy level of care.
Okay.
And we also are able to support as a step down from, say, like an inpatient stay or somebody that may be turning to the emergency department due to mental health needs or emergencies and crisis.
Okay.
So that's really what we're able to do in terms of our level of care. And we're able to serve the age range of age 11 to age 49. So I know it sounds kind of silly, 11 to 49. Why aren't those whole numbers? It's just the silly kind of things that we work along with insurance companies and things like that. But age 11 to 49 in terms of age range, and we help in terms of mental health needs anywhere from anxiety to suicide ideation, trauma, as well as substance use needs, or potentially somebody that's just going through a gender affirming kind of exploration or trying to discover who they are, and they need some extra support.
Okay.
So we offer a ton of different things like that.
Yeah, loss of somebody that you love, right?
Exactly. Grief. Yep.
Grief. Yeah, that's why please check out the website because it gives such great information about all of the different, I don't want to say the right word is conditions, but what people might be dealing with and how you can go ahead and serve them. Absolutely. What is that process? I'll call it an application process. I think you call it a referral process. If somebody is saying, you know what, I might need the assistance of Charlie Health, what can I do?
Sure, yeah. So we refer to that as a referral process. We are a self-referral company, which essentially means you can turn to our website. Anybody's welcome. You can go ahead and submit support for yourself, a family member, a friend, anyone you know who really just needs an extra hand. And you can turn to the website, or like I said, you can definitely support, or I can support you rather, directly if you reach out to me via email or my cell phone. I'm happy to point you in the direction of any type of care.
Right. And you cover quite a big area in Pennsylvania with the work that you do. Tell us more about what you do, Amanda.
Yeah, so I specifically cover from Allegheny County all the way to Erie, but there's people like myself in 38 additional states of U.S. that work for Charlie Health right now. And what I get to do is I get to visit with therapists, social workers, in and out of residential companies and facilities, and really just get to know people that are supporting those that are struggling. And then I get to help essentially guide people to our care that are in need of our services.
So Amanda, I did read a little bit about your free mental health support groups. Could you tell us about that?
Yeah, thanks for asking. So, something at Charlie Health that we love to do is offer anybody in the open community to tune into our free virtual support groups that we offer to anyone. So,
Okay.
that's for anyone that is not in our specific programming, but they would like to benefit from like a once a week type of virtual setting and be surrounded by other peers like themselves who may know someone else that's struggling or they're struggling themselves. So, we do offer those free to anyone in the community.
Okay. And if an organization is interested in learning more, Amanda is also available to come and do a presentation for a group so that the individuals within your team or organization know that this is available, correct?
Yep, absolutely.
And what's the best way to reach you?
Best way is probably email or phone. Whatever works for you works for me. I'm flexible. So, yeah.
Well, I know I see you all around Butler County. You're doing great work to help other people, connecting them to the services to help them overcome and improve their lives. We're very thankful for the work that you are doing.
Thank you.
And thank you for being on the Butler Buzz.
Thanks for having me.
Of course. And thank you. Thanks for watching this episode of the Butler Buzz. If you want to see more, just click on the playlist button up here. To keep up to date with all of Armstrong Neighborhood Channel, click on the subscribe button down here. Hey, I suggest you do both. See you next time.